Welcome to Iswam Virtual 2021.
Good afternoon, everybody. Welcome back in Virtual Iswam 2021. Today is the 7th of January 2021, and we have a session this morning about face contouring and face volumizing. And then this afternoon, we will continue with the topic special about eyebrow. This is about brow aesthetic. Is it still in demand? So for all of you doctors, we need to know and we need to hear it from two special doctors. We will have two speakers this afternoon. The first speaker will be from Indonesia. That is Dr. Teguh Tanuwijaya, and Biomed Master of Anti-Aging. And then the second one, we will meet Dr. Haryanto as the plastic surgeon from Indonesia also. Before we meet them, they already here and we shall greet them. Hello, Dr. Teguh. Dr. Teguh Tanuwijaya. Hello, Dr. Arianto. How are you, Dr. Teguh?
Hello, Dr. Santi. Thank you for introducing us. So I'm good. And for everybody in another country, I also would like to tell all of you that now I'm wearing Indonesian national shirt, which is batik. So this is quite awesome, right? So if you, all of you all over the world would like to get this batik, just come to Indonesia. Thank you.
Nice batik, Dr. Teguh Tanuwijaya. Hello, Dr. Arianto Habibi. How are you, Dr. Arianto? Yeah, how is everything there?
Fine.
Fine, yeah. Hope Dr. Teguh and Dr. Arianto always in a good health and stay safe always. Okay, before both of you give your presentations, I will briefly read your CV. The first CV is for Dr. Teguh. Education background, graduated in medical degree of the Faculty of Medicine, Erlangga University, Surabaya. Master degree in biomedical anti-aging medicine of the Faculty of Medicine in Udayana University in Bali. PhD doctorate in anti-aging medicine of the Faculty of Medicine Udayana University, Bali. Dr. Teguh is the President Director of PT Parmindo Rimpang Koko, and he's the CEO of PT Teta Derma Estetika. As the President also for Commissioner of PT Mediglobal Sarana Perkasa. Dr. Teguh has been speakers in many international scientific events in the world, and also he is the speaker in Iswam. Okay, this is for Dr. Teguh. The second speaker, I will read the CV also from Dr. Arianto Habibi, plastic surgeon reconstruction from Indonesia. Education, 2007-2013, plastic surgery residency at Department of Surgery Faculty of Medicine from Indonesia University, Jakarta. 1991-1997, medical doctor of Faculty of Medicine, Indonesia University, Jakarta. Dr. Haryanto is a plastic surgeon at Samsudin Hospital in Sukabumi, West Java, Indonesia. And then a lecturer at Hospital Faculty of Medicine, University of Atmajaya in Jakarta. He is also lecturer at Muhammadiyah University of Jakarta and Bandung Islamic University. Okay, so let's start with the presentation. So now Dr. Teguh and Dr. Haryanto will talk about the trending topic, foxy eyebrow. The cat eye by ultrasound track. So please, to Dr. Teguh Tanuwijaya, you can start your presentation.
Thank you, Dr. Santi. Good afternoon for all of you in Asia Pacific area. Good very early morning to all of you in America region and Latin America. And good morning to all of you in Europe area. So today, as mentioned, as explained by the moderator, I would like to do presentation with my colleagues, Dr. Arianto Habibi is a plastic surgeon, friends of me, about the eye beautification. So as all of you have understood that eyebrow and canthus lateral beautification become very popular since 019, 020 because of, I think, US movie stars, Hadid, Bella Hadid, and the sister, they are introducing the foxy eyebrow. So now, both of us, me, myself, I will do presentation how to do it without any surgical procedures. So using non-surgical procedure, and my colleagues, Dr. Arianto, will explain the something mostly in surgical aspect, and then he also will strengthen my explanation about these modalities. So I believe all of you understand that this technique and these modalities is needed and become very popular for our patient. Okay, so slide please. Slide please. Slide please. Please move the slide. So, okay, thank you. So this one, I show you the picture of Kendall Jenner. So I still also do not know. So she was doing this pattern of her eyebrow using medical procedures only, or makeup. Okay, you can see now the tail of her eyebrow in this picture is lifted up. Okay, slide. So this one is also another foxy eyebrow. So you can see lifting up just only the tail of the eyebrow. Okay, so and you can see actually this lady, she also has a quite lifted up her canthus lateral. But we can do also like for someone who would like to lift it up her canthus lateral to get cat eyes appearance, we can also do it for them. Slide, please. Okay, so this one, cat eyes, you can see me, myself, and my colleague, Dr. Arianto, we were doing lifting up these Indonesian mystery movie stars, not just on the eyebrow, and also the canthus lateral of him. So his eyes looks like cat eyes. Okay, so I just would like to explain you what is the difference between foxy eyebrow, which is just only lifting up the eyebrow, the tail of the eyebrow, and this one, the cat eyes. We are lifting up the eyebrow and the canthus lateral of the eyes. Slide, please. So, of course, these procedures we have to learn. We have to do research to get the best result for the patient who needed to be corrected with this procedure. So we have to get more effective but less complication, of course, and patient safety is the mandatory thing we have to consider. So that's why later Dr. Arianto will tell all of you what should we avoid during these procedures. So I have hundreds patients who already done by this procedure. I was using thread, but then I found many weaknesses and or complication. The most common weaknesses is these procedures. If we just only use simple pattern, it will be last very short. So just around 2 to 4 weeks because of the gravitation. But if we can do fixation, of course, it will last longer according to the durability of the thread. So if we use PDO, it will last around 6 to 12 months. And then another weakness is asymmetry. So is it important that before we cut the thread, we have to consider in sitting position or standing position of the patient to make sure that our correction already symmetry. And some patient we got infection complication. Yeah, so very important to make the hair of the patient should be clean for about 3 to 5 days to avoid infection. Yeah, and then of course this procedure is quite painful, and if we lifting up the skin too much, of course we can get more skin folding, more dimple. But this is normal. The more you lift it up the skin, the more you can get the folding of the skin. So that's why considering the material is very important to get a good result and less weaknesses. And another complication is bruising. As you know, in forehead area, there are so many vascularization, and the skin layer is quite thin. So choosing the right technology of the needle is also important to avoid the bruising side effects. Slide, please. Slide. Yeah. So, as I mentioned before, to get this appearance, both foxy eyebrow and or cat eyes appearance, we can do it in surgical. Of course, it will be done by plastic surgeon. And now, thanks to the technology, thanks to the material, we can also do it by non-surgical procedures. So later, you can see what will be the complication of the surgical procedure to get this correction. So we can educate our patient which one necessary for the surgical or non-surgical one. Slide, please. Okay, so now I think I invite Dr. Arianto Habibi to explain about the surgical procedures. Please, Dr. Arianto.
Okay, good afternoon, everybody. My dear all college doctors, wherever you are. Now I have okay, my part to explain something about the brow aesthetic. Is my slide is being seen now? Is it good? Dr. Santi, Dr. Teguh, can you see my slide?
Yes, it's okay, Doctor.
Okay, my slide has been there, and I would like to make a preview first. I would like to say something about brow aesthetic because in my in our topic is about the brow aesthetic, and there is a question mark. Is it still a demand? I will say it is yes, and I said it's a must probably. Do you agree, Dr. Teguh? Why? Because still in our mind that in 2020, we all the people all around the world has a new things that comes to our life, which is a pandemic, and which with this pandemic, every people all around the world has to wear a mask. Is it right? So what else that we could do to increase our performance other than making something with our eyes and eyebrow? Because that's the only part that we can share, can be seen by other people. Thanks to the pandemic, so this topic will be so related for today. Is it right, Dr. Santi? Dr. Teguh?
Yes, agree.
Okay, so not only for the lady, but also for a man. Come back to the indication of doing the eyebrow correction, which we can see there's a medical indications and aesthetic indication. I won't say many more about this for us. All the doctors, I think, still remember, and you can see it now in my slide. What kind of medical indication and aesthetic indication? So there is a place for doing it. And again, by the time of this pandemic area, it becomes so related. Okay, for surgical indication, surely it is because of the aging phase of our life. Everybody will have that phase in the life. One which has been become more old in their life, and many things will change accordingly. It happens and it cannot be avoided. We cannot just say that I don't want to be old, because everyone will have this change in our life. So surgical procedure will take a place, will hold a place in the aging process. Well, in the face, there's many things that not only for the face but also for the body and other part of our body, including the contouring. I would like to show you some slide about how many is the surgical procedure and non-surgical procedure has been done nowadays. I think it's not only happen in Indonesia, but also in other countries around the world. So non-surgical procedure is increasing now. In total, worldwide, the non-surgical procedure has been also increasing, and the most country with the non-surgical procedures in the United States. You can see it's the surgical procedure that become so familiar, and this is non-surgical procedure that has been divided by the other method, a differentiated method, and we can see this the many modalities could be done for the non-surgical procedure for the aesthetic, and top 10 countries with aesthetic procedure you can see in here. And also for the cosmetic procedure. Okay, back to the topic that Dr. Teguh has brought this afternoon. It is about the upper part of our face. Our face is divided into three parts. This is our upper part, and this is the middle part, and this is the lower part. The upper part of our face is something that is exposed nowadays. Again, because of the pandemic, so it's only the upper part of our body that can be shown to other people, and it is a must. Again, I say it is a must to do something to make it better. And I don't want to give a lecture here, just remind you about the anatomy of the part. You can see there's a skin, there's a fat, and there's a muscle. And don't forget the important thing that we have in here is the vascularization. Not only for the surgical procedure, but also I think Dr. Teguh, who's mastering in non-surgical procedure, is also aware about this structure. Yeah, doc, you will have a very big problem if you do something, then you don't want to get messed with this important part of this structure, right, doc? You don't want to puncture the vein, you don't want to puncture the artery of the face, because it will make very big hematoma, and it's not good. And also you don't want to do something with the nerves in the face, because your patient will end up with a neuropraxia or neurotomesis, and it will not be good also. Okay, and then this part, you remember, it's the vein, which also in the position that usually we use for the non-surgical procedure of the thread lift. And other thing is the ligament. Okay, this is the ligament that we have in the 1/3 upper side of our face. Usually if we do something surgically, we use the incision in here, okay, and go deep down. We have to remember that this orbital area, our eyeball is there sitting nicely because of this ligament. There's lateral and medial ligament. Okay, then back again to the non-surgical things. This is my opinion, because why the non-surgical procedure is increasing nowadays. I think Dr. Teguh will agree with this, Doc. It is right. It is less invasive. It is reduce the recovery time and lower risk complication. Well, we have still a backup plan for this, and for some customer, it is more affordable, I think. Yeah. Okay. This is what we have done with the movie star in Indonesia. It's a TV star, yeah, not a movie star. Sorry, it's TV star in Indonesia. So it's months after. I also amazed this, thanks to the good hand of Dr. Teguh. It's a hand of God for the thread lifting. Okay, it can be done because of, again, we can see the anatomical review. What we have done with him is we're doing like this. Okay, back to the anatomy. We have the ligament in here. So the thread lift goes from here down the ligament of lateral canthal, and then we go it up. So it makes, like a sling. This is the ligament, okay, and we make up the thread lift like a sling to it, so it growing up. If we can see, this is the comparison, like we're doing the facelift with a thread lift or a surgical thread lift procedure. But the point is, what we've done with him is showing like this. I think my part is that I completing what Dr. Teguh will describe, and his topic for the orbital or eyebrow lifting for today. Isn't it, Dr. Teguh?
Okay, thank you, Dr. Ari, for your very understandable and very clear presentation. So now I also would like to continue after Dr. Ari explained all of us about some surgical procedure instead of what I would like to explain non-surgical procedure of the around the eyes beautification. Okay, now about non-surgical, please slide. So of course, just only using thread, we can get non-surgical correction to lift up dramatically. Okay? Once again, to lift up dramatically eyebrow or even canthus lateral. Okay, you can use, last time you can use toxin, but you can also use energy-based devices like RF or ultrasound, HIFU. But if you compare it, of course, the dramatically correction is if we use thread. Using thread, we can use both anchoring or floating thread. I will explain later. But of course, please consider about the gravitation. We have to choose the strong tension capacity of the thread, and also we have to consider to choose strong cox of the thread to maintain the longer lasting and better result of the correction. Slide, please. So that's why I consider to choose the latest technology of thread to be used on this procedure, which is ultrasound thread. So why it will be very strong, I will explain you as later. Okay, slide. So as I mentioned before, you in the word you can get a lot of kind of brand of the thread, but actually in principle there are just only two kind of the thread, which are floating thread, as you can see in this picture, and anchoring thread. So anchoring thread, it has two direction of the cogs, which is become something like suspension each other. Okay, slide please. So as I explained before, to get a longer lasting and good result of around the eyes beautification, if you are using thread, we have to consider the strong thread. Ultrasound thread I choose because it has right now a 4.35 kilogram tension capacity according to the study. So with this very strong tension capacity, we can get ultrasound thread is the strongest thread right now in the world. We can use it for many purpose for our patient. And what is another importance? So this thread, it has so many cogs. Okay, so the cogs is the shape of the cogs is similar with a pyramid. So it has 1024 pyramid cogs along the thread. Okay, so we can get both benefit, very strong of the thread and so many and strong cogs to grip the skin tissue. Okay, slide please. So this is the machine how to measure the tension capacity of the thread, which is I mentioned before, 0.35 kilogram. So slide. Now I would like to tell you about many kinds of the cogs we can get in the world right now. So the history of the cogs. So at the beginning, it was cutting thread to get the cogs. Okay, the cogs is similar with the barbs. Okay, of the fish. So one pieces of thread will be cutted many times, many places of the along the thread, and we to get the cog like a barbs. But of course, it has some weaknesses. So that's why some researcher, some engineer, they would like to produce another stronger cogs, which is molding cogs, as you can see in this picture. But of course, it's not is human. We are researcher, doctors. We always would like to improve the quality of the material, of the technique, of to offer the good result to the patient. So that's why recently, since not more than 5 years ago, some engineer would they can produce the cogs without any hot temperature, which is ultrasonic. Okay, so now I would like to tell all of you about the weaknesses of all of this kind of thread. Please slide. So you can see here, this picture I get it from Aesthetic Surgery Journal 08. So this is about the weaknesses of the cutting thread. So as you know, our body, our facial area, we have muscle and very active muscle, very dynamic muscle to get some mimics. So because of the provocation of dynamication of the muscle, of course, the cogs will be very easy to be ruptured like this picture. So that's why it's not good, it's not strong enough. Okay, slide please. So that's why, as I mentioned before, molding thread is another stronger cause. So this thread is produced using a very extreme temperature difference. So the material should be melted by very hot temperature, more than 110 degree. So the melting point of video is 110 degrees Celsius. So it should be melted, should be heat more than 110 degree. And then after that, after molded, it should be freeze, okay, using very cold temperature. So that's why we can see the different later. So please slide. Now, why I choose, you can see this one, using 10 times magnifying, you can see the surface, the shape of the corks is not compact enough. You can see also the clear color of the surface of the corks. It was because of the provocation by the very extreme temperature difference. Slide. Okay, now this is ultrasound, the strongest thread we can find in the world. So this thread is the cox of this thread is not produced using a hot temperature, but just only vibrated using ultrasonic vibration 33,000 hertz to get the shape of the cox. So that's why, because of the provocation, the trauma of the material is less, of course it will be stronger. So this is the explanation why this thread is stronger than others. Okay, slide please. So you can see now the difference. Yeah? The left side is the hot molding thread. You can see the clear color on the surface. Yeah. So and then the right side, you can see ultrasonic cox. The shape of the cox is very compact, very strong, still very strong because of the less trauma of the material. Okay, so that's why this one is stronger. Slide, please. So in this kind of ultrasonic thread, there are two SKU we can choose for beautification of the eyes. So there are, the first one is ultrasound thread 1, which is USP 1, the size. It will be good if we use this ultrasound thread for lifting up the canthus lateral. And the other one is, what's that? Ultrasound 5, okay, to lift up the eyebrow. Slide, please. Okay, so as I mentioned before, bruising is also should be considered to be avoided. So as mentioned by Dr. Ari, yeah, frontal area, there are so many vascularization, and we cannot choose to avoid the vascular because the thinnest layer of the frontal of the skin layer at the frontal area. So that's why we have to consider how to get the proper technology of the needle to avoid the bruising. Okay, so slide please. Yeah, we have to consider not using sharp needle. Okay, slide. Yeah, as you know, mostly anchoring thread in the world, they are using sharp needle. You can see on the left side, sharp needle, the needle very sharp, usually if in the injectable steering, it has a bevel. Yeah, but at the center is the technology of this ultrasound thread, which is conical needle. So if this kind of needle hit the vessels or hit the nerve, it will offer to the vessel or the nerve to move on the upper side or on the downside of the needle. Okay, so that's why this is good enough for us to avoid the complication of the bruising and pain. Okay, slide please. Okay, I have mentioned this one before. Slide please. Okay, this is the video how to do the procedure. Please video. So today, all of you in Singapore, Malaysia, and Europe will do a demonstration for all of you how to use double fixed pyramid when she would like to get more slim on the jaw. So exit point here, and this one around 4 centimeters is the anchoring side. This side is lifting side. Ini adalah double fixed spine. Ya, double fixed spine needle-nya ini dilihat ya, ini needle-nya ukuran 23G. Ya, jadi ini ada markingnya setengah senti dari ujungnya needle. Ini bukan sharp needle ya, ini conical needle ya. Jadi teman-teman ada mungkin merasa kesulitan menggunakan conical needle, terutama nanti ketika menembus jaringan kulit atau jaringan lunak di bawah kulit. Saya akan memberikan tipsnya bagaimana menggunakan conical needle ini dengan mudah, ya, dengan drilling teknik. Ya, nah, ya, jadi ini sangat mudah. Lihat jari saya, ya. Saya lakukan drill, ya, seperti ngebor, ya. Now, I have arrived. Ya, saya sudah sampai di exit point. Okay, look at this. Yes, very easy. You will not get the bend of the needle. Jadi tidak perlu mendorong terlalu keras. You don't need to push it too hard. Ya, just drill it. Saya sendiri ya, karena saya sudah sering mengerjakan ini, ya, exit point-nya ini saya masukin lagi untuk mengunci supaya lebih tahan lama. Ya, nanti next time akan saya tunjukkan tekniknya. You can feel the sound like krek-krek, ya, and the patient also can feel it. Oke, so ya, jadi ini ditekan aja di tempatnya dimple, ya, lihat, ya. Nah, sekarang relatif no dimple. Okay, so unfortunately, I cannot explain you during the video presentation because of something technical with the platform. So, but I would like to explain once again. So, at that video, what you just consider, what you just learn is how to make a pattern, how to lift up just only the eyebrow. So using reverse V pattern, very simple one, is not the fixation one. Okay, so now slide this one, you can see also the difference. You can see the lifted up of the eyebrow, and you can see, as mentioned by Dr. Ari, one of the indication if ptosis, right? At this patient, because of aging, she has quite ptosis of the palpebra superior. You can see the double eyelid is missing on the lateral side and now become lifted up after procedures. Okay, slide please. Okay, so another pattern. This one is the very advanced pattern. To get longer, longer lasting of the correction. So I make a fixation, but please make sure that don't fix the fixation until you consider the symmetry or asymmetry, the balance of the eyebrow in both sides. So this is quite complicated, the procedures, but very good results, very long lasting. Okay, slide. Okay, slide. Yeah, this one, fixation. Okay, slide. Okay, this one, cat eyes, as also mentioned by Dr. Ari. So I would like to show you the pattern. Slide, please. So this one was the pattern. The first one, I lift up the eyebrow using reverse V, and then you can see the challenging part of this technique is after we pass the canthus lateral, we should move it. We should bend the needle as much as possible, become 90 degree and quite deep to lift up the skin tissue and the ligament as mentioned by Dr. Ari to get the cat eyes appearance. Okay, maybe Dr. Ari, you can also explain to the attendees about this pattern.
Okay, Doc, as I mentioned before, there's two ligaments that hold the eyeball in the orbital area. There is a lateral and medial canthal ligament. So what Dr. Teguh has done is just like I mentioned before, he make a sling to the lateral canthal. So it makes the part of the lateral eye goes up, and if we don't do something with the ligament, it will look very weird because only the skin goes up while the eyeball is still in there. So it's very weird. So if we would like to do something, we should also considering that the part of the superficial things like a skin and a soft tissue is going up, while also for the eyeball is going up following the lifting. That's all, Dr. Teguh.
Okay, thank you, Dr. Ari. So we were very proud to get the result of this pattern, and I have tried to serve to get this kind of pattern, lifted up the canthus lateral using thread. So I think this one is the first in the world. Yeah, hopefully. Slide, please. Okay, so this one is the before after. Just only foxy eyebrow, very easy. I just use ultrasound fine for this correction. Slide, please. You can see the difference. This one also, yeah. This one is also using ultrasound fine to get this kind of difference looks. Okay, slide. This one, I'm using the fixation pattern. You can see this one after a month. So after a month, you can see the result is still quite good. Slide. This one, yeah. So using ultrasound 1 with the stronger lifting effect. Okay, slide. The same thing, I was using ultrasound 1 to get a stronger lifting effect. Slide. Okay, thank you, everybody. Both of us, me and Dr. Ari, would like to say thank you to all of you for your attendees in this presentation. Hopefully, it will be very useful for all of you all over the world. Thank you.
Okay. Thank you very much for the presentation, Dr. Teguh Tanuwijaya and Dr. Arianto. It was very incredible, yeah, how we can do aesthetic and correction at the brow, yeah, at the brow area. From the questions box, I still haven't got, but for all of the participants, I inform if any of you want to give questions either to Dr. Teguh or to Dr. Ari, please, you may write down your questions in the question box and I will read. We will discuss it together. And while we're waiting, I would like to ask to Dr. Teguh, for the doctors, I mean the beginner doctors who wants to do correction for the brow, like you mentioned using the ultrasound thread, what should we notice? Because some doctors, usually they're afraid if we put some thread on the forehead because it's very thin, it might get some line that we can see the line from the thread. So what to notice, and then yeah, how many threads do we use for each eyebrow? Could you please explain more detail, Dr. Teguh?
Okay, Dr. Santi. So to get a good result and to avoid the complication of the procedures, we have to learn everything properly. Number one, we have to know pathophysiology of the correction, and number two, we have to understand about the technology, the material we would like to use, and then number three, we should be very well trained to avoid the side effect. And then while we start to implant the thread, there are 5 steps we have to do. First one is we have to prepare everything properly, the material, everything, sterilization, okay. And then number two, we have to do a treatment plan, make a marking for the eyebrow. We just need 1 pair, so 1 pieces in each sides, okay. Number three, and then we inserting the thread, and after that, of course, we trim it. Trimming is most important to avoid the infection complication. If we are not proper in this step, in trimming steps, it will be produce an infection side effects. Okay, make sure that all parts of the thread should be inside of the skin. Number 5 is forming, to reduce downtime. So we can manage the dimple, of course. Okay. So once again, you have to understand the dimple will occur because of the grabbing effect of the cox of the thread. Okay, if it grab it too strong, too much, of course it will produce the dimple, the skin folding. And then how to release it? You can do in opposite way. Just release it. Release a little bit the grabbing effect of the cox. So it will, of course, reduce, and the dimple will be gone. Okay, so that's it.
Okay.
Anti.
Yes, thank you, Dr.
If I may
yes,
add
Dr. Ari.
something, okay.
Yeah.
Back
Please.
then to the basic, okay. Dr. Santi mentioned that what if there's a newbie doctor or doctor just want to join doing this non-surgical aesthetic procedure, right, Doc?
Yes. Yes.
I just want to add something. Don't forget the anatomical consideration. Okay, as my slides has mentioned that how to differentiate between the surgical and non-surgical. Again, the first consideration is surely for me it's about the age of the patient. Why? Just like Dr. Santi has mentioned that we just worry to do the thread lifting because we don't want that the thread will be seen just or just like uh, there is some shadowing, shadowing
And the forehead,
down the
yes.
skin of the forehead. For the young person or person below 40, which has still many collagen in the skin, okay, that risk will be lower.
Okay.
So, by the age of the patient is adding, the older patient. That's the point that you should worry. Okay, because the skin has become thinner, the collagen is less.
Yep.
Okay, and if there's a dimple, just like Dr. Teguh said, because of the technique that's not been perfect yet, it's for the older patient, it's be more difficult to be correct.
Okay, thank you,
First
Dr. Ari.
consideration is the anatomical, okay, and then you consider the age of the patient.
Age of patients, yeah. So we have to be careful. Okay,
Thank
so
you.
now we already get some questions in the question box. I will read. This one is from Dr. Ubeta. Are there lots of people who wants to get prefer to get the eyebrow look? Maybe Dr. Teguh or Dr. Arianto?
Sorry, please repeat the question.
So the question is, wait, Ubeta. Yeah. Are there lots of people who prefers to get the eye-cat appearance? So are there lots of people who wants to get the eye-cap appearance? Could you please explain, maybe Dr. Teguh
Okay,
or
so
Dr. Arianto?
to my experience in my daily practice, of course, mostly people they just would like to get eyebrow, just only lift up the eyebrow. Yes. But some of them also, especially that one in the camera, the job in the camera, like model, like movie stars, they would like to get more definition of our face. So they just also would like to get can lift it up their canthus lateral. So, but as a doctor, we have to educate our patient. So we cannot just do what they ask us to do. We have to consider we are in this field, in the aesthetic medicine, we have to mix science and arts. So we have to consider which one better for the patient. Sometimes they just only like to get, they just follow the needs from their patient, from their friends. But we have to consider if it's not necessary, we have to advise them not to do like that. Okay, maybe Dr. Arianto, you can.
Yeah, my answer is yes, surely. As I mentioned before, this pandemic has make us has make a new style for all of the people around the world. We only can show this part of our face. Okay.
Yeah, sure.
Especially the young woman, they would like to still would like to be seen as attractive as it could be. So probably it would be a trending topic. But I said yes, it is.
Yes, thank you, Dr. Ari and Dr. Teguh. Yeah, so we have to.
Also, I think he is also a plastic surgeon, young plastic surgeon. So we can discuss and.
Okay, we have another question here. May I read another question? This one is from Dr. Maria to Dr. Teguh. May I ask, should we always do cat eye procedure to aging patient? Maybe we make it specific for aging patient, maybe above 45 and above. Could you please explain, Dr. Teguh?
Yes, the answer is no. So cat eyes is mostly for aesthetic purpose, for aesthetic indication. So to correct the aging process, ptosis, we just do what we call it right now is foxy eyebrow, but the concept, the principle is lifted up the eyebrow and also the palpebra superior. Okay, maybe Dr. Ari, any?
I agree with Dr. Teguh. It is not a must.
Okay.
So it is one of the option, but Dr. Teguh has made it very, very good. So it becomes not an option, I think. I think in a few months after this, many people will like to have it.
Okay, thank you, Dr. Teguh and Dr. Ari. We've got another question. This is another question. After the thread at the eyebrow, if the patient needs to do botulinum toxin at the forehead, is there any caution to do botulinum toxins? Please, Dr. Teguh or Dr. Ari.
Okay, so depend what the needs of the patient. They would like to get a botulinum toxin injection. But if you would like to combine it, of course, the best way, first you do a botulinum toxin for the eyebrow area to make it soften, and then after 2 weeks you can do the insertion of inserting the thread. Yeah, but if you just only would like to get a correction on the forehead lines, after you did the thread for the eyebrow, you can do it. Nothing complication you can get because of this too.
Okay, thank you. And then another question, which one? Yeah, another question is there, this is about technically, Dr. Teguh, about thread. Is there any possibilities to correct the thread leaf if while we doing the thread, and then can we pull it and we pull it too hard? I mean, this is rather technically, the question is about technically. Could you please explain it?
I still cannot get the point of the...
So, is there any possibilities to correct the thread leaf if we pull it too hard?
Yes.
So maybe the result after we do the thread, and then the result, the patient is not satisfied with the result because it's too high. Maybe this is a question.
Yeah, of course, even without, of course we can we can release it easily. Yeah, as I mentioned before, even you are not doing releasing procedures, it will be quite easy to release because of the gravitation. Okay, but if you do fixation, that one I show you, you have to be careful because this is very quite strong. It will disappear according to the following the durability of the thread. So please be careful. Don't fix it before you decide that this is the best position of the eyebrow. Okay.
Okay, thank you. Next question. Now, hi doctor, how long does it take for the dimpling because of thread leaf will resolve in eyebrow procedure? So after the procedure, if there's a dimpling, how long will it disappear?
Okay, once again, number one, if you are doing thread, you can do it even without any dimple. So if the patient don't want to get any dimple side effect, you don't make any dimple. I mean, you don't pull it too hard. Okay, but many patients, after they have a second correction, they will ask you to pull it as hard as possible. So that's why you can get more dimple. But once again, I explained many times in many countries also, you can manage it very proper. Just only release it. Release the gripping effect of the cork. You will not get any dimple anymore. But of course, it will be released. The lifting effect will reduce. Okay, so this concept you have to understand. Don't be worried. Don't be afraid because of the pimple, because it's very easy to be solved. Okay. Thank
Okay.
you.
Thank you, Dr. Teguh. And then we have the next question. This is from Dr. Tias. For my point of view, the Caucasian is more suitable for fox eye regarding their face. What do you think, Dr. Teguh and Dr. Arianto? Please, maybe Dr. Arianto, you would like to comment about this?
Okay. Again, go back to uh, the aim of the purpose of the using the aesthetic procedure. It is not about the race. It is not about the other things, but it is about the demand of the patient.
Okay.
Okay. So it's not about the Asia, Caucasia, or Africa, or whatever it is. The patient have a right to decide whether he would like to be shown like what. But just like Dr. Teguh has said, we as a doctor cannot be just what you say, the doer. Whatever the patients want and we do it. No, no, that's not the doctor. So we have to consider also how good is it for her or for him.
Yes.
I think
Okay.
that's my
So
opinion.
I
Yeah.
would also to share my opinion.
Mhm.
So this is about that what we consider the best appearance of our patient. As a doctor who working in aesthetic field, yeah, we have to condition ourselves to be something like an architect of the face. Yeah. So we can imagine, we can predict what will be good for our patient. So yeah, I agree. Caucasian is not Caucasian, yeah, especially Latin America. Yeah. So there are some doctors from Latin America now, Dr. Yusuf from Ecuador. Hi. So uh, in their face is quite sharp, quite uh, shapes. So of course, if we lift it up their canthus lateral, it will be much better for them. But if we have Asian with Mongoloid, Caucasian race, yeah, Mongoloid, so we have to consider, yeah, it will be good or not to lift up the eyebrow or the canthus lateral. So that's why we have to be agree that we are the decision maker for our patient. Thank you.
Okay, thank you very much, Dr. Teguh and Dr. Arianto. Because we are running out of time, we have to finish our session. Again, once again, thank you very much for Dr. Teguh Tanuwijaya and Dr. Arianto Habibi, plastic surgeon, for this very nice discussion. And before we end, could you please give some message for these all doctor participants? Please, to Dr. Teguh first, and then Dr. Arianto.
Yeah. Thank you, Dr. Santi. So to all of you, once again, learn hard, yeah, research harder to get to make ourselves as a doctors, as a community of the doctors, to be appreciated by all human in the world. And we have to offer the more effective procedure and less complication of the procedures. So we should always learn and doing research. Okay, and thank you for your attending. So once again, for thread is very good result, very dramatically result, and less complication. The most dangerous complication is just only quote unquote infection, but we can also, of course, solve the problem of infection. So don't be afraid, don't be worried, just learn it properly and mastering your hand. Okay, good luck. Thank you.
Thank you, Dr. Teguh. Now, for you, Dr. Arianto, please, your message for these doctors.
Okay, my dear all colleagues doctors. to participate in this topic. I would like to say two things. First of all, is don't forget your basic uh, uh, medical things, which is anatomy. Okay, once you remember the anatomically consideration for your patients, you don't have to worry. But still, you have to open it again, look up again the your book, or now we can use our gadget, yeah, to remember again. Uh, don't do something before you're mastering the anatomically consideration for the area that you would like to do it. And the second thing is, okay, just like we also always be mention for our patient is don't forget to wear the mask, keep the distance, and then wash the hands.
Okay,
So,
thank you
thank
very
you.
much, Dr. Arianto Habibi, Dr. Teguh. So this is the end for the session about brow aesthetic for everybody. After this, we will continue with the next session. We still have one session for this afternoon after this. To Dr. Teguh, to Dr. Arianto, thank you very much. Success for both of you. Stay safe and stay healthy. Okay, see you. Everybody, stay tuned in this channel. Hello, everybody. Yeah, we're still in the fourth session, and in this session we will talk about forehead and eyebrow rejuvenation, and we will have the speaker from Italy. He's a plastic and aesthetic surgery. This is Professor Luca Piovano from Italy. So let's greeting Professor Luca. Hello, Professor Luca.
Hello, good morning.
Good morning,
Here I
Professor
am.
Luca. Yes, how
Yes,
are you?
fine, very good, excellent in Italy. Can you hear me well?
Yes, we can hear you. That's very great.
Yes.
Okay. Before Professor Luca gave his presentation, I will briefly read his CV. So as medical education, 1981-1988, medical degree from the First University of Rome, La Sapienza Medical School, graduated with honors. And postgraduate medical education, 2006, Manhattan Eye, Ear, and Throat Hospital, advanced in aesthetic plastic surgery, the cutting edge. And then 2001, Pontificia University Catholic of Rio de Janeiro, Brazil. And then 1999, Clínica Médica José Hermílio Curado, Brazil. So many postgraduate, yeah, and Professor Luca has been speakers in international scientific, yeah, and also Professor Luca has been in several times in Iswam, be the speaker in Iswam. Okay, so no more longer, we will have the presentation from Professor Dr. Luca Piovano, Plastic and Aesthetic Surgery. Please, to Dr. Luca, the time is yours.
Okay, thank you for presentation. Thank you for Iswam to invite me to speak about forehead and eyebrow rejuvenation, my last experience during the last 20 years. And for me, it's an honor to take part of your family. From the last 8 years, every year I will be present in your congress. It's a very huge congress in the in the world, and I am so happy about that. And today we focalize, after the beautiful presentation of Dr. Tegu on the upper third, I will introduce my experience, surgical and aesthetic medicine experience in the upper third of the face treatment. It's very important, the upper third, the eyes, the eyebrow, the forehead, for the expression. You see a very famous actor that give his appearance, his beauty, about the shape, the look of the eyebrow, of the eyes. And that is from female and from man. Italian famous actor is Sadness actor, and a French actor, very beautiful actor. You see the shape of the eyebrow, and again from USA, so on. It's very, very important, the shape of the brow, not yet the positioning, but the shape is more important to have a beautiful appearance, a beautiful transmission of the eyes. In fact, the disharmony of the upper face is expression related and offshore aging related, but these two combinations are the most important. It's not only the elevation is important, but the shape of the eyebrow. And you can see this interesting paper in PRS in 2018 about Gubiti, about the shape of the eyebrow. And the beauty of the forehead, for sure, is due to the fullness, the curve, of the forehead, and also the eyebrow positioning, shape, and fullness projection too. And in your country is very, very important, most important that in our country, the shape, the height arched eyebrow, the low district crease, no sadness, the positioning of the lateral canthus is very important, and the fat, the fullness of the full mid face is very important for the ethnic beauty. And look this picture, it's very interesting. In the first picture, we see good eyebrow shape and good shape of the face, but the positioning of the eyebrow is low, medium high, and high. Is not a lot influencer about the beauty appearance, aesthetic appearance, but the shape is very important. Look down, the poor eyebrow shape and aesthetic appearance, the sadness face, more hungry, is the aesthetic appearance. So the shape of the eyebrow is more important of the lifting. So to tilt the eyebrow is our goals, not to lift the eyebrow. We have to lift with an artistic sense of beauty to have a good result in European, in Asia, in USA, in all over the world. It's more important the shape of the eyebrow, not yet the tilt of the brow, the lift. So we see we have a camouflage technique, we have medical protocols, and we have surgical technique to improve the shape of the upper third. Today, I will share with you my experience with medical protocols that I do in the last year of my experience, and surgical technique, what I do in the past, what I do now for improve the upper third. So At first, we have to divide these two procedures. The first procedures, surgical procedures, and the other medical procedures are aesthetic medicine procedures. No blood, no cutting. So in surgery, we use to make a lifting, repositioning. In aesthetic medicine, we don't cut anything, but we use threads, as Dr. Tegu showed you. We use filler and botulinum toxin in combination. The surgical procedures is planned. We planned one surgery procedures and stop. In aesthetic medicine, we have a progressive approach to have our correction. We start with botulinum toxin, we put threads, and last but not least, we put filler to have good shape of the and projection and fullness of eyebrow. In surgical procedures are not reversible. In aesthetic medicine is reversible. Our results stay on 4 months, 6 months, 1 year, 2 years, no more. We have to reproduce our procedures. And then let's come on. We can have infection in both procedures. In surgical, in aesthetic medicine, we can have procedures. The result is predictable in lifting because if we do a straight planning, we can have this kind of result. With aesthetic medicine, botulinum toxin, filler, the result is not yet predictable. And finally, the most important for me is that the result of surgery is sharp and stable. In aesthetic medicine, we have blurred and variable result. That is, with surgery, I will be more predictable in my result, more warranty for the patient, and the last result. But anyway, a lot of patients don't like surgery, also in Italy, and they prefer to do aesthetic medicine approach at first. But finally, our goals is the same: to have a beautiful forehead, fullness, with lifting action, restoring volume, and in total harmony. So let's a quick review on medical techniques. We have talked about suspension threads. Dr. Tegu have a very complete lecture about that, and I don't speak too much about these procedures. He is the master. And botulinum toxin filler, yes, we work on. But at first we have to have planning our treatment, to speak a lot with patient, to make evaluation of what she want, what she don't like, what we have to correct. Then we do some picture to make more evaluation and consent form finally. And just 2 slides on threads. We have different, as we see before, pattern of threads that is L shape, so-called, that is V shape or U shape, inverted to have elongation of lateral part of eyebrow, and that is my procedures of the last many years ago, 20 years ago, and it is the positioning threads, the planning, the traction, and the anchoring of our threads. But let's go to pure aesthetic medicine, because threads is not aesthetic medicine, but is in the middle, from aesthetic to surgical, are advanced procedures. And aesthetic medicine, we use botulinum toxin. Botulinum toxin is very useful to have balancing of elevator muscle against the depressor muscle. Procerus corrugator orbicularis oris is depressor muscle. So if we block the depressor muscle, the elevator muscle going up in a beautiful positioning for 4, 6, 8 months at least. And that is anatomy. Anatomy is very important. The variation, the frontalis muscle, the corrugator muscle, the pressure anguli muscle, and orbicularis muscle. And in green, you can see the depot, 2 units of botulinum toxin, allergen botulinum toxin for that, 4 units, 2 units, to have a blockage and elevation of elevator muscle, frontalis muscle only. And now I want to share with you my experience all over the world with this kind of procedures, botulinum toxin. And that is very didactic picture. In green depressor muscle, in red elevator muscle, when I have to block, where, when, how I have to block with botulinum toxin. 70 units in total of botulinum toxin allergen for this patient. And sometimes I use filler combination. Filler, what kind of filler? I use a combination filler, calcium hydroxyl apatite based filler, very good. Polylactic acid is very good, it's very common in Korea. Polycaprolatone based filler, I use a lot, it's a fantastic filler, long lasting filler. And HA based filler is very useful to have the correction, especially around the eyes. But in my experience, the around the eyes I prefer is mandatory to use lipofilling only in the eyes area. And that is the patient that we see before with botulinum toxin application. And after we complete our treatment with filler. In this case, we cover the temporal hollow with calcium hydroxyl apatite. This green area is full corrected with calcium hydroxyl apatite. And that is the patient before and after. You can see the skin improving, the volume, the elevation, the restoring. If you see, the elevation is not too tilt, but just the correction of the shape, the head, the corpus, and the shadow of this eyebrow. Look at this lady. It's not beautiful lady. It's difficult to have beautiful, but she improved his face with this treatment. And again, another treatment, we can use microbotox for over the fullness of the face. Microbotox I usually use in combination with hyaluronic acid, and that is another hyaluronic acid and botulinum toxin, the same session to correct the eyebrow positioning, fullness, and expression of this beautiful Italian patient. And I have a little video how I do the combination. These procedures, Yalu Botox, I standardized almost 3-4 years ago. Then what is this? That is the patient. He already have a blepharoplasty, upper and down, but she has problem with the eyebrow, the forehead shape. And I make evaluation of the muscle tightening, the positioning, and I mark all over the forehead where I have to treat. You can see in red is one area that I don't use botulinum toxin, only filler. Because in this red area, if you use botulinum toxin, you have no elevation, you have no grip of the eyebrow. So what is microbotox? Yalu Botox is a little depot of hyaluronic acid, botulinum toxin in full face. So I improve the stretching effect of the skin, the volume, botulinum toxin is low dose, is 8-12 units per ml of botulinum toxin of hyaluronic acid. I use amino acid. I use this device injection to have a uniform distribution in one droplet divided in a lot of micro droplets in the forehead, and that is the micro droplet all over the forehead to have soft superficial blocking and distension of the frontalis muscle, to have elevation of the deep fiber of the frontalis muscle, but I show you after in a little diagram. So the hyaluronic acid helped me to have distension of the wrinkles of the skin, hydration. The amino acid improve the fibroblast activity and improve the skin quality, and so on. Full face. These procedures I use in more area, in the forehead, in the crow's feet, in the neck, but now I want to focalize these procedures for the face, for the forehead. Sorry. And that is the goals, the advantage of Yalu Botox is this. If you use the whole method of botulinum toxin injection, we inject in the muscle deep layer. In this way, we inject the superficial layer. The action of botulinum toxin is only in the superficial layer, so the deep layer works. But with Yalu Botox, we have weakening of superficial muscle only. So this weakening of this muscle, and in combination with amino acid and hyaluronic, improve the dermis and the skin. Look, this lady before and after treatment, the skin quality improved a lot. Not all the positioning of eyebrow, but the global result of the fullness of the forehead. I show you this picture. Sorry, look, this lady before and after, before and after. Look, the forehead is full, round, soft, no wrinkles. The quality of the skin improves. So we have a lot of advantage. The global appearance is more relaxed, is better. We have no repositioning of eyebrow for this lady. It's important. These are two tilts. Look, the shape of the eyebrow is a little modification of the shape before and after. And again, the fullness of the forehead after Yalu Botox, hyaluronic acid, the botulinum toxin, before is straight, less, more curve. So this treatment is very, very soft and give you a beautiful result, not long lasting. We have to do one protocol 2-3 times per year, and now we move to filler injection. Filler, we have different injection way, subdermal, supraperiosteal. So we can inject the superficial and deep with different effect. We can use needle 27, 28 gauge in subdermal plane. We can use cannula 27, 25. Each infiltration with cannula is little product. We can use supraperiosteal with needle with cannula in microbolus. So different approach, different product, hyaluronic acid, calcium hydroxylapatite, and PCL-based filler. So it's not interesting. How do you like? Look, this lady. The eyebrow treatment, she already take his botulinum toxin dose. And then to improve more, we inject a filler in these two red lines, superficial and deep. When we inject deep, we have more projection, more fullness. When we inject superficial, we have refinement. We use more viscosity filler. Look before and after. Another lady, eyebrow treatment, little video. I use hyaluronic acid deep on the bone and inject little bolus in a pyramidal way, 2-3 spot dot in the arcus marginalis of the orbits, and we inject this kind of this way. And soon after, to complete our treatment, we inject also in subdermal. So in this way, in the bone, we get volume, projection. And then to have distension of the skin, we inject subdermal. That is the microbolus. The molding massage is very important. And then finally, but not least, which is very interesting, to use the one hyaluronic acid more fluid to have look, this the needle is subdermal, so to have refinement of this treatment. And that is the lady before and after, the volume of hyaluronic acid before and after. No projection, good projection to balance the height cheekbone projection. And then we see this lady that we treat full face with poor skin quality. I use biostimulating filler, PCL based filler. And that is the injection of polycaprolatone Elancey based filler, just a little quantity, is no more than 0.3 or 0.3. Look, the infiltration manner is the same, subdermal, supraperiosteal in combination. So it's a sandwich technique, and that is the lady before and after. This patient was treated with aesthetic medicine before and after. Here, before and after, only with aesthetic medicine, we improve the face in volume, in the shape of the zygomatic arc, the eyebrow, but she wants more and we need surgery to get more. And that is the patient after facelift and eyebrow repositioning. Look, is completely changed. So just to speak about the difference of aesthetic surgery and aesthetic medicine. Aesthetic medicine, that is the goal, the result, blurred result that we can get, but with surgery is completely different. We have tightening of the skin, define of a mandible angle, the jawline is redefined, the volume, and the shape of the eyebrow is straight, long. After surgery, I can do like I want, like how I have planned the shape of the eyebrow curved like she like and we like. And now move to men. Filler is important, but some kind of filler is some long lasting. Look, this man, I put calcium hydroxylapatite, and after 1 year, you can see some nodules about due to the calcium hydroxylapatite stay in the position too. And now we move to another area. In Europe we have not a lot of treatment about that. Is the volumizing effect of the thread. But in ethnic patient, we have a good request about volumization of forehead. Look, this lady from Colombia, empty forehead, fullness of forehead. We use 3 ml of PCL-based filler for the correction of the volume, shape of the thread with filler. Forehead Elancé filler 3 ml. From Korea, this patient, courtesy of Dr. Ong, before straight forehead, after forehead, that is the correction. Look, before and after. So this correction is more common in ethnic patient, not at all in European patient. I'm so sorry. And from Korea, Dr. Kim Jo-seo, before and after correction with calcium hydroxylapatite for the forehead. But now move to surgery. Look, this is typical surgical theater in Italy with Indonesian sister that help us for surgery. And my staff is all women doctor that are working with me for more advanced surgical plan, and that is reconstructive surgery. So I started my experience with reconstruction of depression of the thread with an implant custom made of Gore-Tex to have a stable result for this lady. She tried to have the correction with filler, but she had no good correction with lipofilling, no good correction. We need implant of prosthesis for this lady to have a stable result of fullness of the temporal parietal area. But in aesthetic medicine, we move to different approach, more fine, more delicate. The surgical approach, starting my experience in the 20 years ago with coronal approach. Then I moved to endoscopic. I left endoscopic, and then I tried all these procedures. And now I stabilize mostly my correction with direct approach, but I show you different approach in different cases. The incision is surgical. We need an incision. Incision is in blepharoplasties, supraorbital incision, superciliary incision, direct incision, middle forehead incision, and pretracheal incision. This is very common in US of America, this kind of incision. Endoscopic incision is almost like coronal incision. We don't do anymore for a lot of problem. And I published my experience 2 years, 3 years ago about the surgical algorithm. That is when you would prefer to do one kind of correction and when it's better to move another correction. But anyway, go on practical. That is one old case of coronal incision. It's a big surgical approach with a big downtown to have this kind of correction. And then in younger people, she's famous actor in Italy. We do a coronal approach, endoscopic approach for the brow lifting in combination with lower blepharoplasty and malar cheekbone augmentation, malar implant augmentation to have this kind of result. What is the advantage for this patient? The patient is young, so we have a skin, good skin quality, good skin, good quality of tissue. We need only correction of the hypoplasia malaris and the ptosis of the eyebrow before and after 6 months. And the advantage of surgery against aesthetic medicine is this: 6 months, 6 years is very stable. The implant, the eyebrow shape is stable. The patient have now 6 years more, and she's a little problem in the lower part of the face. She don't have before, and after she have some problem of ptosis of the jawline, but the upper third is very, very stable with this kind of two combination surgery. Then we have a retrograde approach from the blepharoplasty, but this kind of approach I do for a few times because it's not very stable result. We make elevation of the eyebrow, and the stabilization with glue, with stitches is not very stable. So I don't do anymore this kind of procedures. Mediofrontal approach I do because the skin quality in Europe, the phototype 2, we have good scarring, and when we have a long forehead, we have to shorten this forehead. So it's interesting to have cutting all the forehead and to short the forehead. So the mediofrontal approach is good option for European country. Look, this lady is old lady with a lot of wrinkles, and I cut just in the middle of the forehead in combination of facelift, and it is soon after, the day after combination, and it is the scarring result in the elevation of the eyebrow after 6 months. Very good quality of scarring. Then I like to do in America, they like a lot this pre-tracheal approach, is marginal approach. We do usually when the forehead length is too short. And look this, that is the procedures, anesthesia, subcutaneous undermining, traction, elevation, stainless steel stitches, and removing the stitches, the positioning, the shape of the brow is good. So that is a good option, and I do usually when the tracheal attachment is very low, so I can do this kind of procedure. And that is the caudal approach is mostly indicated for ethnic, for Asiatic patient. We cut directly in the upper part of eyelid, and we have elevation of all the complex. And that is last but not least is the direct approach. Direct approach is very interesting. I do a lot because it's very, we can manage easily the positioning, the shape, the stabilization of the eyebrow, and the length of the forehead resulting lasting. The technique was standardized by Salvador Castañales. And that is, it consists in a direct incision, supra eyebrow positioning, incision, removing the skin, lifting, stabilization with some stitches, and closing the skin approach. That is the final immediate before after 1 year, very stable, very happy patient, and I do usually in combination with blepharoplasty. I do a lot, different kind of skin, different patient, different correction, different shape. Look, this kind of result, the scar is here. We don't see, it's very good quality scarring. and again, again. Man, in this kind of man, I do a partial eyebrow lift direct, not too tall, just to opening the lateral part of the eyebrow, like this, before and after. Look the improving of this man, is sad man and after. The lady with aesthetic before and after. This man before and after blepharoplasty and improve better with eyebrow lift. Before planning, and that is very natural. It's not to tilt, not to lift, but the shape is very good. The procedures, cutting, immediate suturing, and before and after. Look the eyebrow. She have no blepharoplasty in this situation, but she improved the eyes opening completely, just elevation the eyebrow. And that is transgender patient. She have the eyebrow for man. He like eyebrow, female eyebrow, and that is before the modification of the shape, just to change the sex, preparing to change the sex. Also, this another transgender, mediofrontal, and that is corrected medial, unilateral medial, balancing symmetrization of the forehead, another balancing of the forehead, unilateral correction. Look this lady, she look hungry like a man. So this kind of was the planning, the lifting action, and the final result. More female, more gracious, more beautiful lady with this shape of forehead. Is not to, I repeat again, not the elevation, but the shape of eyebrow is more important than the elevation. It's not the elevation, but the shape of my final restoring of eyebrow is more and more important. So to conclude this my review about the direct brow lift, this technique that I show you that I do a lot in my country, is the procedures is relatively easy execution, long-term result, little subversion, high satisfaction rate from the patient and from the surgeon. The disadvantage, beware about the scar, because if you have hypertrophic scar, you have some problem or step at the scar. So you have to take care of the scar procedures. Finally, thank you all of you for the attention of my lecture. I am so happy to take part with you. That is my my address, my phone. If you my mail, if you need some information about that, you have to write to me when you want. Thank you.
Thank you very much, Professor Dr. Luca Piovano. What a wonderful presentation. And now is the session for question and answer.
Okay, very good.
Yes, to all participants who wants to give question to Professor Luca, please write down your questions in the question box. And now we already have some questions from the audience. The first question is from Dr. Bea. She's asking about, the first question is from Dr. Michelle. Nowadays, in the pandemic condition, in every countries are doing vaccine for the people to prevent the more spreading of COVID-19. Now, Dr. Michelle is asking, if it is the time for vaccine, which one is better we doing first? If someone needs injection in aesthetic, probably filler or botulinum toxins or many aesthetic therapy, which one we have to do first? The vaccine first or injection? What do you think about this, Professor Luca? Please.
So the filler is the last thing that we do. The first things we have to make threads before, and then filler, I hope, because the filler is we use to complete our result. The flexible threads is the first indication to make the right positioning, and then we cover with filler.
Okay. Yeah. What she means is, okay, that's about filler and botulinum toxins. Now she's asking also about vaccine for COVID-19 nowadays, because now is the condition in pandemic. If it is the time for the patients to get vaccine for COVID-19, can the patient, after having this vaccine for COVID-19, can she get also injection, filler, or many things?
Please, can you repeat, because I don't understand it very well.
Okay.
Sorry.
Yeah, this is about nowadays, because about the pandemic of COVID-19.
Yeah.
In every countries now are being given, the people are being given the vaccine of COVID-19 to prevent to get infection of COVID-19 more severe. Yes. Now, if the patients has vaccine for COVID-19, after he gets the vaccine, is it possible if he gets also filler or botulinum toxins, or she has to wait until a few weeks after vaccine? Or what do you think about this? What is it in your country?
Now the vaccine is almost new. We have some evidence that the vaccine have a immune reaction against our filler. So we can use threads, botulinum toxin, but the filler we have to wait minimum 2-3 months.
I see.
Yes, because we have in the literature we have the evidence with some reaction of the immunity against filler. So the filler now we have to not to use.
Okay, I see. Thank you. And then we come to the next question. This one is from Dr. Bea. She's asking about the microbotulinum toxin forehead. Also make a good result. Is it good for patient above 60 years old? You mentioned in your presentation about botulinum toxins, amino acid, and hyaluronic acid for the forehead area. What do you think if we apply this for patients above 60 years old?
60 years old is too young. In Italy, for the law, we have to wait 18 years old. It's better to wait for the law government.
Oh, sorry. 60 years old, not 16. 60. So for yes,
60. You can use. It's very good. Very good indication, because in the 60 years old we have the skin with poor reaction, not at all to botulinum toxin, but to the skin quality fibroblast activity is very low. So if we give some stimulation by collagen booster is amino acid. Amino acid is alanine, valine, leucine, isoleucine, and it's very important to have booster. Yes, we have to use less amount of botulinum toxin, because in the old patient, the quantity of botulinum toxin we have to decrease a little bit, but the hydration of the skin, due to the hyaluronic acid, the amino acid improvement from dietary and in the injection in the skin is very, very important in my experience. Also in the surgical procedures, when I do in an old patient a facelift, I need to have more elasticity, more hydration of the skin to have better results. So I do infiltration of amino acid and hyaluronic acid. I am doing a study about infiltration, a splint case, one side and other side no, with the Filorga biostimulator product is an NCTF 1.35 in one side before lifting, and I am seeing that the quality of the skin, the scarring is better after.
Okay, thank you very much, Professor Luca. Now we have another question, this one from Dr. Mehta. Hello, Doc. What kind of filler do you recommend to use for the eyebrow? You mentioned also in your presentation, filler for the eyebrow area. Please, Dr. Luca.
Yes, I tried my last year all the filler. Hyaluronic acid is easy to use. You can manage better if you are beginner, because you can have hyaluronidase. You can manage better, but the complication of hyaluronic acid is migration in the high area. If you wrong injection, the hyaluronic acid can go in the periorbital area and give you edema, a big edema. So usually I don't use hyaluronic acid. I use calcium hydroxylapatite, Radies, the name, commercial name, or PCL based filler is Elancé.
Okay.
This kind of filler is long lasting. The advantage of this filler is long lasting. We have no migration. Where I inject, the product stay. So I inject in one point, the product remain in this point, because you give in the tissue a reaction, inflammatory reaction, and the product never migrate. I never see migration. With hyaluronic acid, I see a lot of migration in a lot of patients, not by me, but I see a different problem of edema of the eyelids, both superior and inferior.
Okay, thank you, Professor Luca. We have another question now. The question from Dr. Yeni: how long of the time that is needed until we can do the next session for microbotox? Maybe this is mean for the forehead area, microbotox, that is in your presentation. Can we do it? Can we do maybe every 2 months or 3 months, or what do you suggest?
Yes, I suggest that. So the yellow botox, the combination of hyaluronic acid with botox, we have repeated 3-4 months. 3-4 months. In the meantime, we repeat only hyaluronic acid and amino acid to give stimulation. So the protocol, depending from the patient at first, and then we have to make evaluation of the contraction of the muscle. We have make evaluation of the skin quality. If you have patient young or with a lot of wrinkles, because if not, we have to make a combination of treatment like ABD device, energy-based device, treatment for skin improvement, or we can do peelings. That is, if the patient is young, the yellow botox every 2-3 months is very, very useful, and we have not to do other treatment. But if the patient have the skin quality poor, we have to make combination of treatment, yellow botox plus other treatment. That is.
Okay, yeah, yeah. Some patients in the age of above 60, if we do filler with just hyaluronic acid, why is it after the injection, then the wrinkles comes up? Is it because we do not put the botulinum toxins? Because I have experience like this with patients above 60 and giving injection of hyaluronic acid. Then after a month, she complains that the wrinkles comes up. What do you think about this case, Professor Luca?
So if you inject in the right way hyaluronic acid, we have volume and distension. At first, the edema, the first week, the edema help to have a distension of the wrinkles. When the edema go away, the wrinkles go back, and you have to need to use botulinum toxin, right?
Yep. Yeah. Okay.
It is.
Okay.
But
Thank you very
there
much.
is another evidence. There is
Yes.
a biomodulation of the muscle with hyaluronic acid. Dr. De Maio from Brazil used to do. I don't like to do these techniques.
Okay.
Some doctors inject hyaluronic acid inside the muscle. So what do you have? Do you have a deficit of contraction because you inject some product inside the muscle that make not good action of the muscle. So in this case, you can have modulation of contraction, but I don't like to do this technique.
Okay. Yeah. Okay. We have got lots of discussion about this is eyebrow and forehead rejuvenation, Professor Luca. Yeah, before we close this session, because we're running out of time, please to Dr. Luca, give some take-home message for all doctors who attend this session. Please, Dr. Luca.
So it's very interesting. I understand that the common from my experiences, mostly in Europe. In your country is a little bit different, but anyway, you have to work in a good way to make a good evaluation of the patient before, to take picture, to study your picture, and sometimes also like video, because in the video with a simple iPhone you can see the movements, the symmetry of this patient, and then you can have starting your treatment with reversible procedures. Reversible procedures is the aesthetic medicine procedures with hyaluronic acid, and then you can put one threads. So the final result it will be progressive, not to have a big attack on the patient. Understand? That
Okay.
is that I suggest to all the doctor.
Yes. Thank you, Professor Luca. So we all, to all doctors, please remind if before we do the treatment for patients, correction with filler, with botulinum toxins or others, we have to take pictures of the patients, as Professor Luca mentioned, so we can compare the condition of patients before and after. This is to give satisfaction also for the patients. Besides that, safety is important, as Dr. Luca has mentioned. Okay, thank you very much, Professor Luca Piovano, for all your sharing about your experience, all your photos about your patients. We do hope you always in a good health, stay safety, stay healthy, and always success. We hope to meet you, Professor Luca, next year or after the pandemic ends. Okay, thank you very much, Professor Luca. To everybody, all doctors attending, this is the session of today's session of Iswam Virtual, and don't forget, follow the Iswam Virtual schedule. We will have next schedule that will be on 9th of January 2021. So everybody, thank you very much for joining this session today, and have a great day. Stay safe, stay healthy all. Goodbye. Goodbye all. Thank you very much, Professor Luca.
This global organization and MD a global event. This September 2021. The world will come to Indonesia. Two weeks of competition. An experience of a lifetime. A journey to empower women. Embrace cultures. And to crown Miss Global 2021.